So I am Dr. Taylor DeBusk, and I am originally from Denton, Texas. I went to LSU for undergrad, go Tigers, stayed down there for med school, and then trained all over the country, up in Minnesota and California. Now I'm back in Houston, Texas. This is where my wife is from, so I didn't have much of a choice on where we were going to end up. We have two sons. My oldest son, Liam, is almost 3. My youngest son, Levi, is almost 5 months. And we are loving Houston, Texas, the heat and all. I've always wanted to be a surgeon. I don't know when it started, but I love working with my hands and I love helping people. But choosing to become a surgeon is much more selfish than my desire to help because I just really enjoy operating. So I've always known I wanted to be a surgeon, but that instance when I knew I wanted to go to med school, it's just always been there. I mean, I played football in college, and I remember my first day realizing that I was not nearly as good as the rest of the guys, and I had to have a backup plan. So med school is always there, and by playing football, it reaffirmed the fact that I needed to go to med school because I didn't have a future in football, that was for sure. Yeah, so microvascular surgery, specifically to the head and neck, is we use a lot in head and neck surgery when we're rebuilding defects after cancer resections. So if you have to remove a large part of the jaw, you can take the bone and soft tissue from the lower leg, along with the artery and vein or the blood vessels, and then hook the blood vessels up to those in the neck. So you have vascularized tissue when you're rebuilding the jaw or large defects of the face or oral cavity. There's several different routes of training to establish those skill sets. Within ENT or head and neck surgery, people don't realize that the large portion of ENT training is head and neck cancer, both the resection or removal of the cancer as well as the reconstruction. So I spent 5 years in Minnesota largely just doing head and neck cancer, both cutting it out or removing it, as well as reconstructing, along with a lot of the facial plastic surgery, both aesthetics as well as reconstructive. I mean, I've done microvascular surgery or reconstructive surgery in patients as young as 3 years old up to, 98 years old. So it's a broad spectrum because there's a lot of tumors in the head and neck that aren't necessarily cancer, but that do need to be removed. So you get a pretty good well-rounded experience from the reconstructive standpoint. So we use the microscope and we use very, very small suture, smaller than that of the diameter of a hair, to sew the arteries and the veins and the nerves together. So when we're doing or looking at somebody's face from an aesthetic or cosmetic standpoint, number one, I'm extremely comfortable with the anatomy of the face, given my background. And number two, when you reconstruct the face, you always have to take into account the cosmesis because you want to make sure that the patient looks as normal and can function in society as they did prior to removal of any sort of facial cancers or anything like that. So aesthetics has always been a part of my training and my experience. Now, when we go to purely aesthetics, again, my understanding and comfort with all tissue planes of the face really gives me that advantage or that edge. My ENT or head and neck surgery background, we were operating on noses from my first day in residency, doing septoplasties, things on the inside of the nose. So we had a very fundamental understanding of the entire anatomy from a functional standpoint early on in training. Then in our residency, my specific residency up in Minnesota, it's a very high volume facial plastic experience. So we did a lot of functional and cosmetic rhinoplasty as well as cleft lip or palate rhinoplasty. So again, that's a rhinoplasty in kids 2 years, 1 year old, all the way up to patients 80 plus. So we had a very high volume experience in our residency, did probably 200 rhinoplasties. So my understanding is pretty sound of the nose, of the anatomy. And then the ability to manipulate that anatomy to give you that aesthetic or your cosmetic goal, now that's a whole nother level, which I love and enjoy because you have to know the anatomy. And then number two, you have to know how to manipulate the contour of the cartilage to give you that desired outcome. Nasal bone fractures are a very common thing that we see. The beauty is, to be honest, a lot of nasal bone fractures don't need to be managed. Even if you have a pretty severe fracture, a lot of times you don't even notice the millimeter, sub-millimeter movement of the bone. A lot of times we intervene on it mainly if there's a functional issue, because it's hard to tell, especially with a kid hitting the nose and things like that. It's hard to get a severe fracture. Now, I do have a pretty extensive history and experience in managing facial fractures just in general. So I've seen all kinds of nasal fractures, from nasal bones looking like sawdust to kind of hairline fractures. There's a pretty wide array of management options. We always kind of quote, or I quote when I talk to patients, that the revision rate after a primary or initial rhinoplasty is between 10 to 15%. So 1 in 10 people will possibly need a revision rhinoplasty. It's either they don't like the cosmetic result or they can't breathe well out of the nose. Now, when I look at revision rhinoplasty, the main thing that I talk about is the need for extra cartilage or grafting structure pieces to help rebuild and reshape the nose. Because typically when patients have their initial rhinoplasty, a lot of the spare parts or the spare cartilage has been removed. So I talk to patients a lot about using their own rib. Depending on the patient's age and their specific concerns or comorbidities, the rib is a very nice piece of cartilage to use to rebuild the underlying structural framework of the nose, as well as use it for grafting to obtain the specific contour that you're looking for. Quite often, I do a lot of functional plus cosmetic rhinoplasty. So priority-wise for me, number one is always function. You have to be able to breathe out of it. A close second is form, or the way the nose looks. If the nose is this beautiful little thing on your face, but you can't breathe out of it, you're going to realize that breathing is your priority. A beautiful nose isn't beautiful unless you can breathe out of it. Getting to know the patients, number one, it's a process with surgery. And I tell all patients it's a year-long process. Getting to know you, coming up with the surgical plan, performing the surgery, and then following up through that first year. It really, you're kind of there hand in hand with the patients, and it makes the time really just speed up and fly by, because again, you're setting that expectation, and then you as a surgeon are really wanting to make sure that the desired outcome is achieved. So you're always looking forward to seeing your patients when they come back, it's a really exciting and fun process. Yeah, they should expect to get to know me as a surgeon. I always introduce myself, explain my background. I talk about my wife and kids. I want them to know me as a person. Every surgical patient, I give my cell phone number. Some people say that's crazy, but for me, for patients, a lot of times, this is the first major surgery that they've had, especially when it's a cosmetic surgery. It's a little bit more kind of on the line because it is something that's not necessarily needed or required, quote unquote. Because again, it's a 12-month process from as soon as that incision's made until you're fully healed. So a lot of times they have questions or things, and I want them to be able to get a hold of me as easy as possible. So anyways, when I meet them the first time, I just want to get to know them. I want them to get to know me. I want to know what they understand, what they know, what their desired outcomes are. Because some people come in saying, I want a neck lift. And I'm okay. And then you talk about, well, what their goals are. Well, they're like, well, I don't like where my jowls, my cheeks, my eyes. I'm like, okay, well, neck lift can help only a part of that. So I like to talk to them about the different options to achieve their desired goal. So I really make sure I understand the patient's desires or goals on that initial consultation, because I don't want there to be any ambiguity between my desired outcome and theirs. So I use 3D imaging software specifically for rhinoplasty, because rhinoplasty, again, sub-millimeter changes can make all the difference, or the sub-millimeter desires are hard to articulate for some people. So if you can get a nice 3D image, both of us will be on the same page. Facelifts, I do have 3D imaging that I use. Sometimes it's hard to get that desired outcome on the current technology, but doing a lot of tissue manipulation in clinic, in the mirror, and things like that can show you really what sort of goal or what sort of outcome we can achieve. So rhinoplasty and facelift are really kind of my favorite. One that I like a lot and I've been doing a lot more of recently is just the deep neck lift in younger patients, 30s, early 40s, where you're not removing a lot of tissue or anything, but you're just improving the contour of the neck. And I'm sure you know this or heard this, especially in the Zoom era. Everybody's looking down at their phone or on Zoom and realizing, whoa, where is this double chin coming from? So you're starting to see a lot of these younger patients come in, and you can do amazing things to the neck with one small incision, just removing a little bit of the deeper soft tissue and sewing some things together and really improving the contour. Yeah, I mean, I think the team is just as important, if not more important than my role, to be honest with you, because I mean, they're the ones that are constantly in contact with the patients. They kind of set the expectation before they even meet me. And, they are the face of the practice, the team is, because they, like I said, they are the ones that are really interacting with the patients, discussing the pre-op, the post-op, seeing them more often than I am. And you can't do it alone. And I've learned that in my first year of practice where, I was doing the majority of everything, from contacting, price quotes, everything, photos, all my own, everything. And it's overwhelming. And you can't do it all yourself because you will drop the ball somewhere. And I've really learned to appreciate the team and really now understand the importance of the team because they do come first. It takes a lot for me to get flustered. I think I'm very relaxed, kind of go with the flow kind of guy. I do have high expectations for my outcomes and from my patients, but overall, very relaxed, easy to get along with, joking in the office. I think in the office should not be a sterile place. I think you need to have good relationships with everybody, very collegial across the board. Because I like to have fun. I want to be in the office. I don't want people to want to leave, to look at the clock and can't wait to get out. I want people to enjoy being around me and around the team. So I am also a clinical assistant professor at the University of Texas Medical Branch, teaching head and neck surgery residents and plastic surgery residents, doing a lot of rhinoplasty, skin cancer reconstruction, trying to develop more of the facial nerve, as well in the microvascular department and things like that. But I do love the education. I love interacting with trainees. It's fun. It's enjoyable. It can be frustrating, but that's also the fun part. Yeah. So debuskmd.com. And then soon my profile and things will also be up on Dr. Basu's website. And then I have an Instagram account, and it's just Dr. Taylor DeBusk.
Basu Aesthetics and Plastic Surgery is located in Northwest Houston in the Town Lake area of Cypress. If you'd like to be a guest or ask a question for Dr. Basu to answer on the podcast, go to basuplasticsurgery.com/podcast. On Instagram, follow Dr. Basu and the team at Basu Plastic Surgery. That's BASU Plastic Surgery. Behind the Double Doors is a production of The Axis, THEAXIS.io.